Oral health disparities and prevention in the United States. My name is Erin King, and I'm a nursing student with Indiana State University. This is a health education program. The population at risk is an increased risk of tooth decay and periodontal disease among African Americans and Mexican Americans in the United States related to comorbidities and lack of access to dental care as demonstrated by social determinants of health. At this point in the presentation, I ask that you pause your video and take the pre-test. What goes into a person's health, and what are social determinants of health? Social determinants of health are things like socioeconomic factors such as education, job status, family and social support, income, and community safety. These types of factors all factor into determinants of health and healthcare status. Healthcare access can be increased or decreased based upon the social determinants of health. Oral health disparities across the lifespan. By 8 years old, 52% of children have had a cavity in their primary teeth. Low-income children are twice as likely to have cavities. For children ages 2 to 5 years old, about 33% of Mexican American and 28% of non-Hispanic Black children have had cavities in their primary teeth, compared to just 18% of non-Hispanic white children. For children aged 12 to 19 years of age, nearly 70% of Mexican American children have had cavities in their permanent teeth, compared with 54% of non-Hispanic white children. Nearly twice as many non-Hispanic Black or Mexican American adults aged 20 to 64 have untreated cavities as non-Hispanic white adults. 47.2% of adults aged 30 years and older have some form of periodontal disease, and 1 in 4 adults aged 20 to 64 currently has cavities. More than 9 in 10 older adults have had cavities, and 1 in 6 go untreated. Non-Hispanic Black or Mexican American adults aged 65 and over have 2 to 3 times the rate of untreated cavities as non-Hispanic white adults in the same age group. Nearly all adults, actually 96%, aged 65 years and older have had a cavity. 1 in 5 have an untreated tooth decay. Nearly 1 in 5 adults 65 years or older have lost all of their teeth. Severe gum disease is most common among adults aged 65 or older, Mexican American and non-Hispanic Black adults, and people who smoke. Among adults aged 65 and older, the rate of gum disease increases to 60%. Periodontal disease increases with age. 70.1% of adults 65 years and older have periodontal disease. Socioeconomic factors impacting oral health. A lack of dental coverage and poverty have been recognized as contributing factors to poor oral health. Socioeconomically disadvantaged individuals are at increased risk for dental-related visits to the emergency department because of lack of access to oral health care. This risk and need for treatment becomes even greater for members of some racial and ethnic groups who have an unmet need for dental treatment, as do people who are poor. Rural populations often have restricted access to dental care and poor oral health. These problems may disproportionately affect older African Americans in rural areas, even when they have some dental insurance coverage. Critical barriers to obtaining dental care and treatment are typically cost-related and related to lack of insurance coverage. Only 1 in 4 adults that have medical insurance coverage also have dental insurance. Medicaid programs are not required to provide dental benefits to adults, and the coverage varies from state to state. What is oral health? Oral health refers to the health of teeth, gums, and includes the entire system that allows us to smile, speak, and chew. Some of the most common diseases that impact our oral health include cavities or tooth decay, gum disease or periodontal disease, and oral cancer. Tooth decay. Cavities are one of the most common chronic diseases throughout the lifespan. About 1/4 of young children, half of adolescents, and more than 90% of adults experience tooth decay. Untreated tooth decay can lead to an infection which can spread to other parts of the body and cause serious complications. Cavities are caused by a breakdown of the outer coating of tooth enamel by acids produced by bacteria located in plaque that collects on teeth. Communities all over the country add fluoride to the water system, and this is a proven prevention method against tooth decay. Gum disease or periodontal disease. Gum disease is usually the result of infections and inflammation of the gums and bones surrounding the teeth. Things that increase your risk for periodontal disease include tobacco use, diabetes, poor oral hygiene, stress, heredity, crooked teeth, underlying immunodeficiencies, defective fillings or bridges that no longer fit properly, taking medications that cause dry mouth, and female hormonal changes such as with pregnancy or the use of oral contraceptives. Oral cancers. Preventing high-risk behaviors such as use of tobacco in any form and excessive use of alcohol are critical in preventing oral cancers. Oral human papillomavirus, or HPV, can cause cancers in the back of the throat called oropharyngeal cancers. Early detection is key to increasing the survival rate for these cancers. Oral diseases can be painful and cause infections that lead to difficulty with eating, speaking, and learning. It also affects social interaction and employability. Here are some tips for good oral health. Drink fluoridated water. Brush teeth with fluoride toothpaste thoroughly twice a day and floss daily. Visit your dentist at least once a year. Avoid use of any tobacco products. Limit alcohol intake. If you have diabetes, work to maintain control of the disease. And if your medications cause dry mouth, drink plenty of water, chew sugar-free gum, and avoid tobacco and alcohol. If you can't afford dental care, you may be able to find help through the following resources. HRSA.gov supports a network of clinics for people who qualify for reduced cost care and may have a dental clinic. ADEA.org. Most dental schools have a clinic staffed by professors and students where the fee scale for care is income-based. ebusiness.ada.org/mystate. American Dental Association may be able to refer you to local dentists who provide reduced rates for care. I hope you found this presentation informative. Please take the post test to see what you've learned from this presentation. Thank you.